From the Detroit Free Press, in the heart of the Motor City, it's Friday, April 17th. Here are today's top stories, presented by Bush's Fresh Food Market. Calling all foodies, Bush's is hiring. Are you passionate about food, looking for growth, development, and excellent wages? Come grow with Bush's and apply online at bush's.com/join-our-team. That's Bush's, BUSCHS.com/join-our-team.
I'm Paul Egan reporting for the Detroit Free Press. Michigan will coordinate with 6 other Midwest area states on reopening the economy. Governor Gretchen Whitmer and the other governors announced that Thursday. They said coordination doesn't mean all 7 states will start easing their stay-at-home orders at the same time. The governors also didn't say when that will happen. Though Ohio and Indiana are looking at early May, Wisconsin on Thursday extended its stay-home order through May 26. Also part of the Coalition for Recovery from the Coronavirus are the governors of Illinois, Minnesota, and Kentucky. They all said their top priority will be worker and citizen safety.
For the Detroit Free Press, I'm Eric D. Lawrence. The man credited with injecting excitement into the Lincoln brand, Kumar Galhotra, now has more responsibility at Ford. Galhotra, described as a down-to-earth but big-deal executive in plain sight, will be president of the Americas and International Markets Group at Ford as part of a leadership shakeup that begins May 1st. The new roles for Galhotra, who is currently president of Ford North America, and others are supposed to help Ford in a number of ways. They follow a 10-week deep dive by Ford Chief Operating Officer Jim Farley. The changes, including the addition of a former Israeli intelligence officer, come as Ford and other automakers are grappling with shuttered auto plants amid the coronavirus outbreak. The industry is also trying to shift toward vehicle electrification and boost driver assistance technology as it faces rising pressures to consolidate. Ford's executive changes are supposed to help the company build a commercial vehicle business in the United States and Canada, leverage data and connected vehicles, and improve quality in its vehicle launches.
I'm Teresa Baldus with the Detroit Free Press. Detroit Police Chief James Craig has beaten COVID-19, and now he wants to help others beat it too.
None of us, I don't care who you are, none of us have had to deal with anything like this. You've heard me say, some of the crises I've dealt with over almost 44 years, earthquakes, civil unrest, mass shootings. But let me just say, there's no textbook on this. And when you assume leadership positions, making the right decision really does matter.
So he's talking about his ordeal publicly, saying it's crucial for people to hear from survivors. The coronavirus death toll has weighed heavily on him, he says, but he wants the public to know that this is beatable. He battled it for 3 weeks from home. He exercised, took vitamins, drank hot tea, and above all else, he says, he prayed. Please report to Freep.com for more on this story.
For the Detroit Free Press, I'm Angie Jackson. Confirmed coronavirus cases inside Michigan's prisons have been climbing daily for the last several weeks. As of Wednesday, more than 480 of roughly 38,000 state prisoners had tested positive for COVID-19. One prison, Parnell Correctional Facility in Jackson, is especially hard hit. There, 10% of prisoners and 21% of staff are confirmed to have the virus, according to an analysis by the Free Press. The infection rate for Parnell's prisoners exceeds that of both Rikers Island in New York City and the Cook County Jail in Chicago. Both of those jail systems are said to be 2 of the country's biggest hotspots. And epidemiologists warn that this is just the tip of the iceberg. They say that there are likely thousands of undetected cases of COVID-19 within the Michigan Department of Corrections. And a high rate of infection should concern the whole community, said Dr. Jody Rich, professor of medicine and epidemiology at Brown University. Rich explains that local healthcare systems could be overburdened if many prisoners with COVID-19 require hospital care.
The danger is that these will come in quicker than us, lead more to a peak rather than a flattening of the curve, that they will, strain resources, and when straining resources, either they won't get in or somebody else won't get in, or both. And then so other people very sick with coronavirus may not get the care they need and may die.
For more stories from the Detroit Free Press, be sure to check out freep.com. That's FREEP.com. And sign up for the Daily Briefing newsletter. See you on Monday.